Hello, my name's Ria and I'm a doctor specialising in obstetrics and gynecology, and the pronouns I use are she and her. These are my 5 top tips. So the first one is to remember the BRAIN acronym. We can often give a huge amount of information in a really small amount of time, and that can be quite overwhelming, especially if you've got someone standing over you wanting a decision. It's okay to ask for more time, and acronyms like BRAIN can just help to filter out some of the noise so that you know you're making the right decision for you and your family. So remember, BRAIN stands for benefits, risks, alternatives, interventions or instinct, and nothing. My second tip is that there is no such thing as a silly question. Often we have this internal dialogue where there are things that we're worried about, but it's hard to communicate them. And with things like Google, it's really easy to just tap that in and find an answer. However, if I'm responsible for looking after someone, I want to know what those little niggles are, because often those are the things you're really worried about. I don't tell people not to Google because I think it's unrealistic, but I'd love to help you work through anything that you're worried about, even if it's so that I can signpost you to appropriate resources. But what I don't want anybody to do is bottle things up, because those thoughts are really important. And on a similar vein to not bottling things up is don't delay asking for help. Sometimes things can happen at a really inconvenient time. You might notice some spotting at 2 o'clock in the morning when you wake up. Don't put things off until the morning because you think it's more convenient. In obstetrics, we're very used to doing things at times that other people would think are awkward. The most common time for babies to be delivered is between 2 and 4 a.m. There is always a team on that can provide support and advice if you need it. So make sure you have their contact details and you can contact us if you're worried. Number 4 is trust your body. You know your body more than anybody else, especially with things that are difficult to pick up, like fetal movements. I could have the best machine in the world that tells me how many movements you're having, but the only person in the world that knows whether that feels normal or right for you and your body is you. So if someone tells me that the movements don't feel right and they don't feel normal for them, even if I have a machine saying that everything is perfect, it's my job to interrogate that more. And you being as honest as you can about what you feel is really useful for helping me to build a picture. And my last tip, tip number 5, is don't be afraid to ask for help if things aren't going in the way that you expect. You can have a perfectly normal pregnancy, and I say normal because what is a normal pregnancy on paper? But if you feel like you're struggling, if you feel like you're not coping as you would expect to, then please let someone know. Pregnancy can be a really exciting and exhilarating time, but it can also be really overwhelming and anxiety-inducing. And if there's any way that we can help you navigate those feelings, it would be such a shame to not pick up on that just because everything on paper seems okay. You deserve to have the best pregnancy that you can do, and that's why we're here.